Welcome to Porchlight, the presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families throughout the Berkshires and the Pioneer Valley. I'm John Krol, and I'm very happy to welcome to the program a relatively new face to Porchlight VNA and Home Care, probably someone that if you are in the healthcare field, you may have already met over the last several weeks. Her name is Amie Miarecki, and she is the Marketing and Development Manager for Porchlight VNA and Home Care. So Amie, welcome to the program for the first time. It's great to have you.
Thank you so much, John. It's nice to be here.
It's exciting. We're here recording this at
Yes.
Lee, and but of course this is online and throughout in the areas that we provide services for. And you have been covering a lot of territory
Yes.
over the last few weeks, meeting our partners in the long-term care and the assisted living area, and even our partners in home care also. So you've been really making the rounds.
Thank you. Yes, we see ourselves as resources for any healthcare organization. We work with a lot of different nursing facilities, with assisted livings, other home care agencies, because we do have both sides of the business. We have the certified or clinical side, and we have the private pay home care side. So we can really partner with many different organizations.
And for Porchlight, this is a new position recently created, and I think from my perspective, it well, first of all, long overdue, but but I think it's an important sign to show that Porchlight is very interested in not only providing exceptional care, because we've been doing that for many years, and it's been recognized on many levels, but then to also have a new level of responsiveness and also, I think, customer service to some extent, because the world of healthcare, it's a wild west for a lot of consumers, for people who are finding themselves into this healthcare world and not really understanding necessarily what the best direction to head in for a loved one. So to have someone like you working with our partners and with our clients, frankly, I think it's an important piece to the puzzle.
Thank you. I do see myself as a resource for either our clients, our patients, or our referral sources, and that is something that's part of my role, and I definitely want to fulfill that. Part of what I'm trying to do is that customer service. Are we satisfying the customer, making sure we're meeting their needs? And that could be either the referral source or our patient or client. So absolutely, I want to have an open line of communication so that we know we're meeting their needs. And if for some reason we haven't, we want to know, and we want to make a change. We want to make sure that we do that.
Of course, Porchlight being a freestanding, a nonprofit, makes sort of the model different than some others out there. And what that means is really all our dollars go back into the high level of care. Again, it's shown in the results. All the we have the accolades and deficiency-free surveys and that sort of thing, elite status, but in addition, it means that we're able to provide some special things. Telehealth monitoring is one of those things. And of course, during the spring and into the summer, we really focus on that because we try to raise a lot of money to provide that extra service.
So the telehealth monitoring is a big differentiator for us in our services. We actually can use it on both the certified or clinical side and also in our home care side. So if you are a home care patient, or client rather, and you are receiving aid services or companion services, you can actually rent the telehealth monitoring system and get that extra coverage and have the connection with the nurse that we have on our clinical or certified side. And on that certified side, we actually have, as part of our protocol for disease management, for lung, heart, and diabetes management, we have this telehealth monitoring system to make sure we're monitoring vital signs for patients every day. And making sure that they're within the parameters that will keep them safe and keep them at home rather than returning to a hospital or the like.
And I think the feedback from our partners in healthcare has been so good with that, because there are a lot of things that you can do as far as providing services. And you can have individuals coming into a home or into independent living facilities for seniors, or even assisted living in some cases. But to have something like that where each and every morning all the vitals are being checked automatically, going to our office
To our nurse.
with a registered nurse who is actually looking at all these vitals and seeing, is there any difference, is there any change with each and every one of these patients. That's something that creates an incredible efficiency.
Absolutely.
And frankly, better outcomes.
Better outcomes for sure. It's part of our continuum of care, so we know what is going on with the patient. Even if we're not scheduled to be in with that patient every day, we can still be monitoring them every day, and we're in contact with their doctor. So the doctor's aware of what's going on with their patient. It really is a continuum of care model that we are endorsing and that we're providing for our patients. It definitely is something that we've noticed better outcomes from, and we invest in it. To be honest, it's not something that we're necessarily being reimbursed for. So as you mentioned, we do fundraise during this summer especially to provide that service to our patients and make sure that we're able to provide that consistently. And pretty much for every patient that is appropriate for the telehealth, we are providing that. What we do is we have our tennis tournament coming up on June 20th here in the Berkshires.
Yes, the Audie
Furgal
Tennis
4th
Classic.
annual
Yeah.
Audie Furgal Tennis Classic. And that's one major fundraiser for the telehealth monitoring. But then we do throughout the year have other fundraisers as well to make sure that the public is aware of this service. I'm pretty certain that we are one of, if not the only in the area, providing that regularly for our patients. And again, clients on their home care side can rent that service as well and be connected to the nurse.
So very crucial. And I think people in the clinical world get it, but I think generally speaking, I think it's common sense that people that who may not necessarily be in healthcare but have a loved one, or
Right.
or is that individual who may need those services, can get why it's so important to have
Absolutely.
something like this and to
It's an
provide
extra
that
eye on the
value added.
patient.
Yeah, it really is. It really is. And I'm proud to be a part of an organization that
Thank
has
you.
something like that. And you've been in healthcare for several years in the long-term care world, even in the rest home world. We were
Respite
talking-
as well.
Respite as well.
Yeah.
So you have a great deal of experience in senior care. So tell me about your evolution a little bit
Sure.
and what brought you to Porchlight.
Sure. So I came to Porchlight after moving back from Boston, being there after college, and met my husband, who's also from the Pioneer Valley. We moved back here to be close to our family, and after working for, as you mentioned, nursing facilities, I worked for the Boston Public Health Commission, so doing a lot of public health advocacy. And I worked with the homeless for years and respite facilities in different settings. I worked with teen moms for a long time too. It's a whole different realm of healthcare, but that's home visiting, and you're actually in the home, recognizing ways to keep that population safe. And home care is a whole different animal, let's say, to inpatient care. You want to make sure that you are connecting with the patient and that the patient knows they have resources. And sometimes you're really the only connection that patient has to the community. You might, they might be very isolated, so you have a lot of responsibility on your shoulders when you're doing home care. And that's actually something that Porchlight takes very seriously, and we try to be a part of the community and be a resource for our patients, and again, for the organizations that are referring to us. So we want to make sure that they're understanding that we are in all different settings, and we can go in and do assisted living, blood pressure clinics, and reach to that population, but also, be in the senior centers and allowing them to really make sure that their health is a priority, because we're offering those services as a community organization, as a nonprofit. So I see myself as working both in healthcare and as a nonprofit marketing manager, and I think it's an exceptional job. I think it's something that a lot of people don't get to do. Most of healthcare isn't nonprofit necessarily, so I love the idea of being able to do the fundraisers and connecting with the community in that way and really giving back. It's really important to me to do that as a person, but also to work for an organization that makes it a priority. Makes me feel really good about my job. So
It is. It
yeah.
really is. And I've had a chance to be with Porchlight for the better part of 2 years, and you definitely see that difference. And I think, again, as a consumer or individual out in the community, you may not necessarily know the difference between that sort of back end, how an organization works and what the model is and what the difference is. But I think very clearly when we talk about things like the telehealth monitoring system, it's a true value added, for a
Definitely.
nonprofit that is solely committed to providing great care in the community. And I think that's something that's been recognized very well in the Lee community, and it's expanded out, into the Berkshires, and of course after the merger with Chicopee VNA, which again, another organization that it's remarkable how similar
Yes, it
Lee
has.
Regional
It's
VNA
been very apparent to me the more I
is.
talk with
Yeah,
with our
those reputations are very
organizations that we're
similar and
partnering
have been.
with. Oh, absolutely, similar reputations for excellence, for community organizing, for giving back to the community, and certainly for being a resource and making sure that the community is taken care of. And we listen and we provide. And that's definitely something I've learned from both sides of Pioneer Valley, let's say, and also being in the Berkshires.
So I would say that while your position is marketing and development manager, a big part of what you're doing is actually education.
Yes.
Because in the time that I've spent with you out in the field and working with our partners in healthcare, much of it is simply the explanation of what home, and frankly even for those who are in healthcare, things are changing so rapidly that the things that can be done in the home, or what VNA services and home care can do in facilities as well, which is where people live. It is their home, but a different type of home than the traditional residential home. That education continues today, because things like the PT and OT and things like that that were once only done in a facility is now being done in a home environment.
And they're being done very well in a home environment. And I think that the trend is certainly that home care is going to continue to grow as a very important part of the home care continuum and the healthcare continuum, to make sure that patients are living life as they know it. And that's our motto at Porchlight, is to make sure that the patient's needs are met. And for that, it means that they're going to go back to the life that they want and they know, and that most of the time is in their home, whether it's their residence or, for a long-term care facility or whatever it might be. And we want to be a part of that. And that's actually why we have the two sides of the business. We can continue to provide for them regardless of where they are.
And to be clear, as again, we'll get to the fun stuff too, because
Okay.
there's a lot. 'Cause we have kielbasa festivals and all that.
Definitely.
We talked about this on the program, but you've been very involved with that out in Chicopee. But it is interesting, yes, that you say that that there are two clear businesses, under the umbrella of Porchlight VNA Home Care, and one is the very clinical nursing. Rehabilitation side, and one is a less clinical but more consumer
But overseen by
focused.
clinical, which I think
Overseen
is a
by
big
clinical.
differentiator.
And that's another aspect. But and even to our friends in the healthcare world, that's an education as well.
Definitely.
But there are these two sides
Definitely.
of Porchlight.
Yep, and we see that as, again, an important part of the puzzle for our patients. One thing that we can also offer is if a patient is seeing an aide on our home care side, our private pay side, and for some reason they are using our clinical side as well, we can actually, most of the time, try to have the same aide go out to them. So that aide might work on our clinical and in our home care side. And again, it's part of that continuum, allowing that patient to have the same person going into their home to provide services, makes them at ease and obviously gives them better outcomes.
Yeah, that makes a big difference when there's someone you feel comfortable with and you can maintain that
And we
relationship.
really try to do that as often as possible.
Absolutely. Now, you do
Yes.
all the fun stuff. Okay, now we
Yes.
now we had our
We have a lot of fun
we
things
had our
going on.
friend Mr. Kilbania,
Tom Kilbania,
Tom,
yes.
on the program, and boy, that guy is a riot.
Yes.
Interesting, fascinating, fun guy. So that's something Porchlight has been involved with. Something like that, a community event that's sort of come back.
Yes.
There's a long history of it, and then it kind of went away. And Tom explained that whole history. But Porchlight has really taken that and jumped in feet first on this community event.
So part of the reason we're involved with the Kielbasa Fest is because we're a nonprofit, and Tom has actually selected us as a recipient for the proceeds from discounted ticket sales. So we've been doing that throughout the past month. right up until the festival starts on the 21st, which is Thursday the 21st. And right up until that day, we can sell tickets to the public and actually get some of the proceeds, and those will go towards the programs like Telehealth Monitoring or our low income fund, which provides services for patients or clients who may not be able to otherwise afford them but do need them, and who we want to provide that for as part of our community involvement. So Tom recognized that in us and recognized that he wanted to make sure we were, he was giving back to us. So it was a really nice partnership that we were able to arrange, and hopefully we'll see some proceeds from it.
Yeah, so the proceeds will be helpful for that.
Mm-hmm.
And then, of course, I'm sure, after this great success this year, it'll happen again next year, because Tom really likes us, I think.
Well, I think he
Porchlight.
and Holly really hit it off, and they had a lot in common. And
well, why wouldn't they?
I know.
Yeah. Two wonderful personalities.
Exactly.
And the other thing that we like to do is there aren't necessarily the kind of honors that we'd love to give our caregivers. These individuals who are certified nursing assistants, home health aides, people who are on the true front line of the work that's being done, and truly the heart and soul. And of course, you have to have the higher level clinical people, and you have to have great people in customer service and making sure people are aware of these services. But when it comes down to it, when your loved one needs that service, it is that home health aide, it is that certified nursing assistant who is doing incredibly loving and caring work each and every day. So we have another event that recognizes them through the Tender Tributes. And that event was held at Laurel Lake, the facility for Kindred in Lee. And boy, what an event it is. And that's another one of the things that we feel is very, very important, because you don't necessarily always get those accolades. And I think caregivers really deserve it as much as any profession.
Exactly. And pardon the pun, but I think that the aides and the certified nursing assistants do a lot of the heavy lifting in the healthcare business, literally a lot of the heavy lifting, and they do need to be recognized, and they do need to have that be a public recognition. So I think we're hopefully filling that for the Berkshires, and maybe we can move it down into our Chicopee Branch area eventually. That's how I would see it. I don't know if there's anything like that going around in that Pioneer Valley. So if we can start it in the Berkshires and continue it, this was our second year, and continue the trend and make sure that we are recognizing those very special people in healthcare and also our partners in healthcare. And again, we are inviting assisted livings, we're inviting nursing facilities, any organization that has a healthcare caregiver. We are offering this opportunity to recognize their excellent employees, basically.
Yeah, and really it is, and I think that it is a part of the heart and soul of providing care, and so to honor these individuals, it's always a special opportunity, and we should always take that opportunity. So the Tender Tributes, good.
And I love the name.
Yeah,
it is very tender. I'm tender-hearted, so I think that it does tug at the heartstrings, and I think it is important. It's very special too.
It is, and again, having all our partners involved in it is also a very special thing. So, because and the other thing is, in healthcare, our population in Western Massachusetts is aging, and the demand for services that Porchlight provides and all our partners in healthcare, especially at the senior care level, it's only going to increase. Now, things may change, and the way we deliver services may continue to evolve and adapt to the changing landscape, but the indicators are very clear that that the need for caregivers like the people we're honoring is only going to increase, and I can tell you that it's probably a challenge for many organizations to have enough caregivers already at this point. Porchlight doesn't have that problem, but it's one of those challenges that we're going to see, and also an opportunity for those for a career.
Absolutely, and we're hiring continuously throughout the year to make sure we do have enough caregivers to provide the services for the patients that we do have, and we want to make sure that we can provide that and and have enough caregivers to to cover all of the bases, basically, in both sides of the business. So continuously hiring, making sure that we have those folks to help our patients.
And then, as far as some of the challenges that we find out there, what are some of the things that you're seeing? Because many of the individuals who we have for referrals come from long-term care facilities that may be providing short-term rehabilitation, and those individuals may be coming home. That's where we can provide services as far as that goes. The hospital certainly is one of those areas where after people have a stay, they really do need home services in many cases. So, what are some of the things that you're seeing out there that are perhaps opportunities for patients to receive
Absolutely.
high quality of care, better care?
Well, one of the most important is, of course, the elective surgeries. When someone opts to have a total knee replacement or another kind of surgery like that, we can certainly provide rehabilitation services in their home to make sure that they're getting the physical therapy or PT and the occupational therapy or OT that they need to, again, maintain their life as they know it. And whether or not that requires a stay at a rehab, short-term rehab, either way, we can provide the services when they need them. So that would be a huge opportunity for a patient to become involved with us, is an elective surgery. But also, most of our services can be referred from any doctor's office. So we have actually had patients that maybe don't have necessarily a stay in a long-term or short-term or even hospital, and doctors can refer. If they see the need for a patient, maybe that patient could use therapies and doesn't need the skilled nursing side of it, but could benefit from some strengthening or some flexibility to allow them to continue to stay in their home, and importantly, stay in their home safely. We can provide those rehab services as well. Similar, if a patient has gone into their doctor's office and they might be experiencing some memory loss or some challenges around a chronic illness, and they don't need necessarily a rehab or they don't need a skilled nursing, but they do need someone to come in and make sure they've taken their medication, or to make sure that they are able to provide showering or other issues for their daily living, then we can provide that as well on our home care side. So those are things that maybe aren't going to be permanent for a patient necessarily, but are going to help them, again, to stay in their home for as long as they can and to be happy in their home.
And of course, one of the big pushes from the federal government and through the whole industry is to reduce readmissions to hospitals, because we know the most expensive place to provide care is in the hospital, especially the emergency room. And that's where I think home care is such an essential piece of this, because by providing those strengthening services, by providing really on a level preventative maintenance, is when you're able to give that extra boost with someone at home, or even an individual who may be in the assisted living area, or even in a senior independent living situation. That's where I think home care is a key component of this overall picture that we're trying to strive for. And I know we've had conversations with our friends at Lee Family Practice, Dr. Kaplan, about the patient-centered home medical model. Home care has to be part of that conversation, no doubt about it.
Absolutely. And I love that you used the word boost, because I think it is a boost. It's a boost to a lot of things for our patient or our client. It's a boost to them physically, but also mentally, to know that they have options, and that the options aren't necessarily going to be to leave their home, whether it's short-term or long-term, that they may need to do that. They will be able to return home. So that is very important, is that the patient has that knowledge.
And on the rehab side, it also, I think, is worth noting that where do you live and where do you spend most of your time, of course, is in your home. So therefore, if you're rehabbing and you're doing occupational therapy and you're doing physical therapy, to do it within your environment, walking up your own steps, getting around your own kitchen. While there are wonderful occupational therapy kitchens and facilities, it's still not your kitchen. So I think there is an incredible value to that, because you're actually doing the exercises and you're actually being able to achieve outcomes in the place that you are actually going to be doing that work from that point forward.
Right, and we have a lot of patients who tell us, it's important for me to still see my grandchildren after when they come home from school, or, and they can be in their home and have their family with them throughout the day, or have their loved one, maybe it's their spouse, with them. That's very comforting, especially for patients who've had chronic illnesses or have had to be in a facility for a long time. It's very comforting to have your loved ones near you as you're gaining your strength back or getting literally back on your feet.
It is a wonderful thing. So, Amie Miarecki,
Yeah.
it has been a great pleasure introducing you, I think, on many levels to the communities that we serve. You are a wonderful resource for Porchlight VNA and home care. How can people get in touch with you, whether there are friends in healthcare or the general public? What are the best ways to get in touch with you?
So I have a work cell phone they can call, which is 413-355-9018. That's the best way to get direct in contact with me. Or you can email me at Miarecki, Miarecki, @porchlighthomecare.org.
That's a wonderful name. So it's Miarecki.
It's my husband's last name too.
Well,
I can't take credit for it.
So
Yeah.
so there you have it, and of course people can find you on the Porchlight porchlighthomecare.org website. You're there, and certainly you're out and about in the community, and I think
And looking for opportunities to partner in the community. Please, if anyone has an idea that Porchlight could help with, or a partnership, then we'd love to be a part of it. Please give me a call and let me know.
Fantastic. So, Amie, a great pleasure having you on the
you.
program. Thank you very much.
Thank you, John.
It has been a pleasure, and it will be a pleasure to continue working with
Definitely.
you. So, thank you. This has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.